The war on Gaza now, and Israeli forces have killed more than 70 people in Gaza early on Tuesday. They included Palestinians waiting for food. Casualties have been taken to several hospitals at different locations across the Strip. The latest killings follow funerals on Monday for Palestinians who were seeking aid in northern Gaza. The Commissioner General for the UN's relief agency, UNRWA, for Palestinians, says the organization's financial situation is dire and that it may soon cease to operate. Philippe Lazzarini says the Israeli authorities have campaigned against UNRWA, including false accusations that it's a terrorist organization. He says their finances are now at breaking point.
Without additional funding, I will soon have to take unprecedented decisions affecting our services to Palestinian refugees across the region. The loss of UNRWA's stabilizing effect on a region increasingly in turmoil will also be consequential. So, in response to the very real possibility of the agency imploding in the face of extraordinary adversity, the United Nations Secretary General has requested a strategic assessment of the impact and exercise of UNRWA's mandate.
Well, for more on the situation in Gaza, let's speak to Dr. James Smith, who's an emergency physician who spent several weeks in Gaza recently volunteering on a medical mission there. He joins us from London. Thank you so much for your time. We very much look forward to hearing about your experience in Gaza. Can you tell us there first about the purpose of your mission there, and what was it that struck you the most during the trip?
Well, so emergency medical teams have been going to Gaza now for more than 20 months. For me, that was a measure of a commitment to internationalist solidarity. So to be present and to work shoulder to shoulder with our Palestinian colleagues. That's really what motivates us as healthcare workers and as people who are committed to international solidarity work to enter Gaza. And the situation really over the course of the last 20 months has deteriorated day on day. There is a very powerful rhetoric at play now. We've entered into a new phase of the genocide, this sort of illusion of humanitarianism, if you like, right. Wherein we're hearing that distributions are ongoing, that people are being provided with food. At the same time, as you've just mentioned in your reporting, tens, if not hundreds of Palestinians are being killed every single day. And these distribution sites, I refuse to call them aid centers or humanitarian centers, these militarized distribution sites are also killing people.
We have been covering, of course, those attacks on distribution sites. Dr. Smith, we've heard about the medical situation, also the humanitarian situation in Gaza deteriorating. Can you tell us a bit more about the conditions in hospitals or the medical facilities that are still able to operate?
So very little medical aid has entered into Gaza. This is now day 115 of the blockade. More than 50% of essential medicines have ruptured in the Ministry of Health's central stores. This means, of course, that healthcare workers are working with drugs that they wouldn't normally use for patients. They're running out of basic medical supplies. Of course, several of these hospitals have been targeted and destroyed, and others have been completely surrounded, which of course is the case currently for Nasser Hospital and Al Amal Hospital in Khan Yunis. The situation there is beyond dire. The hospitals, of course, have already been besieged and occupied by the Israeli military during the course of the genocide, and there's a very real risk that without immediate intervention, the same might happen again.
Thank you so much for talking to us about this and giving us a view there of the situation in Gaza. Dr. James Smith, emergency physician who's just recently returned from the Gaza Strip on a medical mission there. Thank you very much, Dr. Smith, for your time.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.